Hello, today is Thursday, November 14th, and I'm getting ready to go meet with my plastic surgeon to sign pre-op papers and make a final decision about what type of implant I'm going to get, either the saline or the gummy bear, and I will share with you what my decision is or will be. Also, I just wanted to share in the wonderful life of me. My daughter is homesick. She's actually with my mom right now while I go to my appointment. But I just got back from her doctor appointment, her sick appointment, and she has a double ear infection, which it started with her sinuses. She has a cough, something viral, and she just doesn't drain properly through her sinuses. So it caused a double ear infection, which we didn't even know because she wasn't even complaining about her ears. She just has this horrible cough and then got a really bad fever last night. But it's never a dull moment. So double ear infection, and that's what was causing the fevers. So after this appointment, I'm going to go pick up her medicine. It's just nonstop. But anyway, I'm going to get on the road and I will see you in the next clip. Oh, also real quick about my daughter, a little funny fact is today at her school was makeup day for pictures for school. And she was supposed to have her pictures done because when it was picture day, she was sick. And today is the makeup day and she's sick. So, yeah, I guess she's just not meant to have school pictures this year. All right, I'll see you in the next clip. Okay, so I'm in the room and I have my gown on, but I am reading the pre-op papers, so I'm not going to do a room tour. So I'm going to read this and talk to the surgeon about surgery, and I will check in with you after this appointment. See you in the next clip. Okay, so I am back in the car. Let me just update you. Got a lot of information today, good information. So my surgery is scheduled for December 18th. I believe it was 8 or 8:30 in the morning, which is great because then I'll be done early in the day, hopefully. Expected to be done and out of there by like 1:30. And I decided to go with the silicone implant, the gummy bear implant, because what I liked about that, there's pros and cons to both, but what I don't like about the saline is that they can rupture and deflate. And yes, it's safe because it's just IV grade saline that's in there. So the body absorbs it, which is fine. But then you have a deflated breast and you have to have a surgery to get another one put in. So with the silicone, the gummy bear implant, after 5 years, you get a mammogram to check for any tears or anything that might be going on with it structurally. And then every 2 years after that, just keep getting them checked for tears, because if there are any cracks or tearing, you want to plan to have it exchanged for a new one. So that's really cool. I know somebody personally who has not had saline implants, and they literally woke up one day with a deflated breast and had to have a second surgery. So I just don't want to have to go through that. That's really just why I was like, plus there's also rippling. If you lean over with a saline implant, there's more rippling than with the the silicone from what I've seen and from people I've spoken to who have both types of implants. It seemed like the gummy bear silicone one was the better choice for me. Also, I was not able to get another fill today because if you recall in the last vlog, I went last week for a fill, but because of me having a little bit of soreness behind my non-radiated side pectoral muscle, they didn't want to risk over expanding and causing a potential infection or irritation there, which could prolong my surgery. So my surgeon today agreed, just don't do another fill. Just, it is what it is, and this is what they are, and they're not giant by any means. They're relatively small, but this is what I wanted anyway. I didn't want to go bigger than like a low C or a full B, and that's where they're at right now. So she did say today, especially on the radiated side, there cannot be any tension on the skin during surgery. So she's like, they may be a little smaller than what they look like right now, but I'm okay with that. I don't really care. As long as there's something there. And I'll be honest, I actually like them smaller because literally everything fits better. My seatbelt, my crossbody handbag, laying on my back in bed, hugging my daughter, picking up my little dog. I just don't have a giant continental shelf sticking off of my rib cage anymore, and I love it. I love it. I've had giant boobs my entire life, so I'm totally enjoying the smaller side. I am. T-shirts fit better. Shirts in general fit better. Sorry, I'm fixing my phone real quick. Everything just fits better. Tank tops fit better. They look better. This is probably going to sound silly, but it kind of keeps me in check and motivated to keep my weight down because I can actually like see now when my stomach starts to stick out a little. Whereas before I was like, oh, as long as your boobs are further than your stomach, you're good. And that was literally my motto for most of my life, but really they were so big. They were double D's. So that gave me a lot of room to have a big belly, and having a big belly means you have a lot of insulin, which is a lot of estrogen, and estrogen is what feeds my cancer. And I'm trying to keep my weight down. I'm trying to stay healthy as much as possible, and small boobs are the way to go for me. So it may not work for you. You might like big boobs, and that's great. Or maybe you were smaller chested and now's your chance to be large chested. That's awesome. More power to you. I've had big boobs my whole life. My back feels better. Literally, like my upper back feels better. I'm all about it. I'm all about it. I'm happy with my B's or whatever these are. I'm assuming they're going to be a B after everything's all done. So I also got 2 bottles of the Hibiclens because you have to shower with it the night before and then the morning of, just to really disinfect the area. I'm going to have to take all my piercings out again. It also says on here, no herbal medicines for 2 weeks prior. So that means I'm probably the biotin that I'm taking. Definitely vitamin B, vitamin D, probably calcium. I'm going to check in with her in a my chart message just so I have record of it. I'll be like, these are all the things I take, all the supplements. I'm stopping all of these 2 weeks before, right? Just to make sure, because I don't want to mess with anesthesia. But that is pretty much it. Today's appointment went really well. Can you tell I'm like excited? Because this is hopefully, dear God, let it be the last surgery that I will ever have to have ever in my entire rest of my life of living to 105. Hopefully. All right. I'm not going to close out the video yet because I have, what do I have next week? Let me check. Okay, I'm back. I just had to check my chart. I love that thing. If you have a like Cooper My Chart or just even a Virtua My Chart, lifesaver. It's like my little pocket planner virtual assistant that keeps all my stuff organized. I love it. So next week I have my pre-admissions testing. I think that's Wednesday. Pretty sure. I just looked at the date. You think I'd remember. And then I go the day after that for an injection, another Zoladex injection. And then the day after that, I get blood work done because they want to check all my levels not just for surgery, but every 2 months now. I think it's monthly. Monthly, I get blood work done just to make sure their Verzenio is not lowering my white blood count or my neutrophils too low. That's another thing. My oncologist, I see her, I think the 25th. Don't quote me on that. And she may or may not hold the Verzenio based on these blood work results. She might hold my Verzenio for like 2 weeks before surgery, so I can heal properly. Because after you have a wound, you want your white blood counts to not be in the toilet. So they were pretty low from chemo when I had my bilateral mastectomy, and then they were still kind of low when I had my expander surgery, and I was okay. So we'll see. We'll just see. So I'm going to go for now, but I will check back in next week, and you can come with me for all those appointments, and then I'll close out the video. So I'll see you next week. Hello everyone. Today is Wednesday, November 20th, and I am on my way to my pre-op appointment for my surgery. So let's get on the road and I'll see you in the next clip. So I'm walking to the pre-admissions building. It is, you kind of have to walk through a building, go back outside, and then go into the building. So I'll see you in the next clip. Okay, so I just had to run to the bathroom real quick, but they took my blood pressure and pulse ox, all of that was good. Next up is blood work, and then I'm all done. So I'm gonna go do that, and I'll see you in the next clip. Okie dokes. Let's see if this will focus. I'm all done. I got my blood work done. That was so easy. But yeah, that's it for today. Tomorrow, sorry, I'm looking for cars so I don't get hit. Tomorrow I go for another Zoladex injection in the morning, and then Friday is more blood work. Surprise, surprise. But this is to test, this is the monthly blood work that I get to test for my estrogen levels, to make sure they're in the basement, as my oncologist says, and glucose and neutrophils, white blood count, all that fun stuff. All right, so I'll see you tomorrow. Hello. Today is Thursday, November 21st, and it's raining. It rained a lot last night. We haven't had rain in like, I don't know, 40 something days. Then we had like rain a couple days ago, and then we had a monsoon thunderstorm weird freak thing last night. Lost power for like a minute maybe, and then it's still like spitting raining today, and it's chilly. It's like damp. And here's me, idiot me, in a tank top. But I also have hot flashes, and I'm about to go get a Zoladex injection in my gut, which is more hormones, which means more hot flashes. So that's why I do it. Like, my fingers are freezing cold, but I'm hot. Does that make sense? No, it doesn't make sense to me either. So I'm gonna get on the road, and I'll see you in the next clip. Okay, so I'm in the room. We're just waiting to get my injection approved by my oncologist and pharmacy, and then I'll get injected and then be on my way. So I'll see you in the next clip. Okay, so I just got my injection. My next injection is scheduled for the day after my surgery. So just hit me with your best shot. All right, I'm gonna say hi to Coop and I'll see you in the next clip. Whew. What a nasty, cold, like damp day. But anyway, that's it for today. Tomorrow I have to get, what am I getting tomorrow? Blood work. Even though I just got blood work done yesterday for pre-op, this is a different type of blood work for tomorrow for my oncologist to see where my estrogen levels are and to check like white blood count, red blood count, glucose. Sorry, I'm a little winded. I was just like running because it's cold. Just like my usual stuff, that my CBC and metabolic comprehensive panel, I guess is the technical term. I actually did get results back already from yesterday's blood work. And, you know, the hospital, they read the readings. That doesn't make any sense, but on like a larger scale. So to them, my white blood count is low. But to me, I was like, well, that number is higher than last month's number. So I'll bet you tomorrow in the blood work, the way that it is going to be read for my oncologist, it'll be in the green. I'm just going to put that in this little vlog note and see, we'll compare them. I'll put up on the screen the hospital's WBC and then tomorrow's WBC, white blood count. I'll bet you they look good on one test, but they look really low on another. We'll see. All right, so I'm going to hop off for now, but I'll see you tomorrow for blood work. Good morning. Today is Friday, November 22nd, and I'm getting ready to go get blood work done to double check all of my levels just for my oncologist to make sure everything's okay. This blood test will also determine whether or not I will be holding Verzenio for surgery, which I probably will hold it. I think I will just hold it anyway, just so for wound healing, so I don't have like a lower white blood count. Speaking of Verzenio, last night at the ripe hour of 3 a.m., it happens all the time, between 3 and 4 a.m. actually, I was on the toilet with cramping and pain, and how many rounds did I do? Like 4 or 5 rounds of diarrhea. So, yeah, I also ate dinner a little bit later than my normal yesterday, so I don't know if that had something to do with it, but I fast in the morning. Like, I take Verzenio in the morning and at night, 12 hours apart. So like 8 and 8 or like 7 and 7, depending what time, or 7:30 to 7:30, whichever time I take it in the morning, I take it that time at night. But if I eat dinner too close, like within like an hour to an hour and a half to when I'm going to take Verzenio again, it without fail, it doesn't matter what I eat either, without fail, I'm woken up out of my sleep at 3 a.m. with cramping, like horrible, like menstrual cramp, borderline labor pain. Seriously, cramps from Verzenio. And then I'm on the toilet with like diarrhea, and first it's poop and then it's diarrhea, and it's horrible. And I end up having to take like 2 Imodiums after like the last blast, I call it. Like, all right, this is probably the last one, so let me start the Imodium, get it in there, and I just hang it, and I get the chills. It's horrible. It feels like you're like getting the flu for like 5-10 minutes before you have this episode. It's terrible. But I'm going to try, because in the morning I don't feel this ever. So it's because I'm fasting. There's nothing in there like to upset Verzenio, or for Verzenio to upset, if that makes sense. So what I'm going to try, just to see if this helps, because I'll try anything. I might start, I'm going to keep fasting in the morning, but for dinners, I think I'm going to have my main meal whenever I break my fast. Like, it won't just be like snacky little stuff like I always do and then I have my dinner. I'm going to have like my dinner for lunch. So like probably like between 1 and 3 p.m. is when I'll eat my main meal for the day. And then for dinner, I'll have my shake. Because usually I'll break my fast with a shake and then I'll have my dinner later. And I'll have like a shake and like a snack, like a shake and I don't know, like a string cheese and an apple or a banana. And I don't know, what else do I eat? Like nuts and stuff. Like I eat like random things. Every day it's different. Sometimes I'll eat those like, what are they called? Popcorners. They've been my thing lately. Just the plain sea salt ones. Because they're real mild. I don't get like diarrhea from it. So yeah, my whole diet has changed pretty significantly because of Verzenio. Can't even talk. I'm so tired. But yeah, I'm going to try that out. I'm going to try moving my dinner meal to like mid-afternoon. So it's pretty much digested by the time I take Verzenio for nighttime and just have a shake at night or fast. We'll try it. Yeah. And it's funny because I ran into a family member earlier this week and they were like, wow, you're getting skinny. And I was like, not really. Like I am compared to what I looked like last time they saw me. But all I could say was, I'm like, I just don't eat a lot. Like I don't, because of the Verzenio. I don't want that pain. So I eat, trust me, I'm not a teeny weenie. I still got some love on the handles. Trust me. But I have lost weight because I just can't eat the way I used to. And I can't eat big quantities either, like I used to, because I get diarrhea. So it's kind of cool. It keeps me in check, keeps me in line, but it's a very painful, uncomfortable way to be kept in line. So we're going to try the shakes for dinner and the main meal during the day when Verzenio has already been digested and the second dose hasn't come in yet. So we're going to do that. And for now, I'm going to get on the road and go get my blood work done, and I'll see you in the next clip. All right, I'm here. Got my blood work papers ready, and I'm actually early. My appointment's for 10 a.m. and it's like 9:09. So I'm just going to go in as a walk-in, which is cool because they don't look too busy right now anyway. So let's get in there. See you in the next clip. Okay, so I'm all done. I have like a nice tight ace bandage style self-sticking tape around my my arm where they do the needle. That's actually really smart because I'm not sure, my red blood count's low, and I forget what else was low. A lot of stuff's low. So I almost look like I'm anemic technically, I think, on paper. But anyway, just gotta apply extra pressure whenever there's blood or blood drawn or a bruise or something. So that's pretty much it now for this week. Next week on Monday, I meet with my oncologist. That might be the last time I meet with her before surgery. So I'll bring you along with me for that to see whether or not we're going to hold Verzenio, and if we are, for how long. Definitely probably a week. Definitely probably. That's how I talk. I'm sorry. You're probably like, I'm so contradictory. Definitely, probably, maybe, not sure. That's my brain. Probably going to hold it the week after just for wound healing, and probably the week before, but maybe 2 weeks before, because my pre-op papers say no supplements 2 weeks before surgery, like no vitamins or supplements, because it can interact with the anesthesia. And I take a lot of that. Like I take biotin now. That's what's helping my hair grow, because I'm having like some thinning issues, as you can clearly see here. So I'm trying to get that. My nails are finally growing, which is cool. So I take biotin, I take vitamin B complex, I take D, I take calcium. What else do I take? I think that's pretty much it. Right? I don't know. But I pretty much will only be allowed to take my Zyrtec every day and my cancer medicine, like my hormone meds and Verzenio. But if they're holding it 2 weeks before, oh, that means I won't be getting diarrhea, hopefully. But that also kind of sucks, because when I have to start it up again, I'm just realizing this right now as I'm recording, that I'm probably going to have to go through the whole Verzenio thing again, because that was bad in the beginning. It's finally like leveled out to like sometimes Whereas when I first started, it was like all the time. Boo, that kind of stinks, but whatever. Anyway, I'm rambling. So Monday I meet with my oncologist. I think that's it for next week. Let me check. Okay, sorry. I just had to check my little app that like keeps everything organized for me. Yeah, that's the only thing I have next week. I think that's my last appointment until surgery. Yeah, so that's nice. Oh my gosh. But next week is Thanksgiving. And guess what else? My daughter is home from school pretty much the entire week. I think she goes on Monday, and then it's like a half day Tuesday, and then she's home the rest of the week. So that's cool. I'll be able to enjoy the holiday with her and my mom and my family and friends and get to like chill and not be at the doctor's office all the time. Love that. All right. So that being said, I will see you on Monday for my oncology appointment, and then I'm just going to sign off for now. So I hope you're having the best day, and I hope this video helped you in some way, shape, or form. If you are going through your cancer journey, your breast cancer journey, and you're kind of following alongside mine, or you're right behind mine, or you're just finding out today, like, what's life going to be like a year out from being diagnosed, I hope this video helped you. And I hope all my videos help you in some way, or someone that you love and care about, that you're just like doing research on behalf of them. I hope my videos help you understand what they're going through, or what they're going to be going through. So, and if you are doing that, I just got to give you some props, because that's really cool that you're taking the time to educate yourself and familiarize yourself on behalf of a loved one. Because sometimes people don't want the sympathy, they don't want to talk about it, or they just don't want to, like, they don't want to be reminded of what they're going through. They're in like survival mode, and I get that. So they might not tell you how they're feeling, or what they're up against, or what they're going through. I mean, there are some people that when I said I have breast cancer, I had people reaching out to me from my past, and past employees that I worked with, or coworkers that I worked with, old friends, people I went to school with, letting me know that they had it. And I had no idea they even had it. They were real quiet about it. And that's fine. Everybody operates differently. So it's really cool if you are a caregiver, or if you're just a family member, or a friend, or husband or wife of somebody who's going through this, or a child. You could be a daughter, a son, whatever, going through this, and maybe the person isn't talking about it, but you know something's wrong, or you know it's bothering them. At least you can relate on some level of what they're going through, and what they're going to be up against, or what they've been up against. So it's props to you for taking the time out to do that for them. And I think that's really sweet. All right, so I'm rambling. I'm gonna go. I love you guys so much. Thank you so much for watching my videos, and I will see you in the next one. Bye, everyone.